wide on our website and the CBC News app. We're standing by for Prime Minister Trudeau's pandemic update. It is his first since the crash of a Snowbirds jet in British Columbia that killed Snowbirds team member Captain Jen Casey and seriously injured the pilot of that plane, Captain Richard McDougall. So we are expecting the Prime Minister to address that in his first public comment since the crash. We are, of course, also expecting any sort of update on the government's response to the pandemic. In this case, more information about that business loan available for business owners through the Canada Emergency Business account on a day when 3 more provinces are lifting some restrictions and allowing the reopening of more businesses. That will be here in this province, Ontario, in British Columbia, and Saskatchewan moving on to the next phase of its reopening plan. The Prime Minister expected out in about a minute. Today he goes over to he participates virtually rather in the COVID-19 committee in Parliament as well. So he starts his briefing a little bit earlier on Tuesdays and on Thursdays. While we wait, very briefly, probably, I'll bring in my colleagues, the host of Power and Politics, Vashi Kapellas, and the CBC's David Cochran. Good to see you both. Vashi, I think we are expecting the Prime Minister to talk more about these small business loans that have had a fair amount of uptake. 605,000 businesses have applied for those loans so far.
Yeah, he's going to talk about those loans, and the main criticism so far is the people who have been unable to qualify. So if you don't have a payroll between $20,000 and $1.5 million, so you pay yourself, let's say, in dividends, you're a sole proprietor or a small family business, or you have contract workers. The other big announcement is going to be on the border from the Prime Minister. There will be a 30-day extension at the U.S. border of the current restrictions.
Thanks, Vashi. Here's the Prime Minister of Canada.
To extend by 30 days the current measures in place along the border. This is an important decision that will keep people in both of our countries safe.
This morning, I can confirm that Canada and the United States have agreed to extend by 30 days the measures currently in place at the border. This is an important decision which will protect citizens on both sides of the border.
I also want to address the tragic RCAF plane crash in Kamloops over the weekend. My thoughts and the thoughts of all Canadians are with the families of Captain Casey, Captain McDougall, and the entire Snowbirds team. This has been a very difficult few weeks for members of the Canadian Armed Forces. As we mourn, we remember Captain Casey as a proud Nova Scotian and an outstanding servicewoman, a journalist who turned her talents to the forces. She will be remembered not just for her professionalism, but for her sense of humor and for her kindness. As we honor her, we pay tribute to the bravery of all those who serve today. Our women and men in uniform are always there for us, serving overseas to defend the values we hold dear, working here at home to care for our seniors and lift our spirits with flyovers. So to everyone who so proudly wears the maple leaf, thank you. You do your country proud, today and every day. In
the wake of the tragic crash of a plane of the Royal Canadian Air Force over the weekend, Canadians stand with the family of Captain Casey, Captain McDougall, and the entire Snowbirds team. As we mourn the death of another heroine, we pay tribute to the courage of all of those who serve our country. Every day, you make us proud.
As we start to carefully and gradually reopen our economy, a lot of people will be wondering what that means for them. If you've been laid off, you're probably waiting to see whether your employer will start up your workplace and rehire you. To help them do that, we've extended the wage subsidy through the summer. This is about getting people back to work and giving businesses the confidence to reopen, rehire, and even grow. Because the way our economy will recover and the way our country will remain resilient and successful is by getting Canadians back to work. Many business owners are already benefiting from this program to rehire and maintain the crucial link between workplace and employee. To employers looking to start up again, please rehire your workers. Use the wage subsidy for their paycheck. That's what it's there for. And for businesses that still need help, today we're taking another step forward. Today I can announce that we are expanding the eligibility of the Canada Emergency Business Account. If you are the sole owner-operator of a business, if your business relies on contractors, or if you have a family-owned business and you pay employees through dividends, you will now qualify. For example, for a hair salon owner with stylists who rent chairs, for a local physiotherapist, for an independent gym owner with contracted trainers. This is for you. We'll have more details very soon about when you'll be able to apply. But we heard you when you said you needed a hand. That's why Minister Ng is also working on potential solutions to help business owners and entrepreneurs who operate through their personal bank account as opposed to a business account or have yet to file a tax return, such as newly created businesses. And, as we announced last week, there's new funding for regional development agencies too, which you can always contact if you still don't meet these expanded criteria. Businesses like yours are the backbone of our economy and the lifeblood of our communities. And whether it's with the CEBA or the expanded wage subsidy, we're in your corner.
In order to help small business owners cover their expenses, we are expanding eligibility for the Canada Emergency Business Account. Already, more than 600,000 small businesses have received a $40,000 loan under this program. But we know that there are more people out there who need help. So, if you are the only owner and employee of a business, if your business depends on contract workers, or if your business is a family-owned business and you pay employees with dividends, you will also be eligible. For example, if you have a hair salon where your stylists rent their chairs, or you're a self-employed physiotherapist, or the owner of a gym that employs contract trainers, the program will be there for you. We are working hard so that people can keep their jobs or return to work, and we're doing that by helping small businesses that are so important in our communities, because that is how Canada can fire up again. Of course, so that we can get through this crisis, we also have to have enough medical material and personal protective equipment so that people can stay healthy and safe. This morning, I'd like to update Canadians on personal protective equipment. In recent weeks, we have doubled our inventory of surgical masks and face shields. This week and in the coming weeks, hundreds of thousands of hospital gowns, face shields, glasses, and swabs will be delivered to the provinces and territories. We have also received an order of ventilators from Zoll in the United States. And because we want that equipment to be produced here in Canada as much as possible, we continue to increase our production capacity. We have now let 15 contracts right across the country to manufacture hospital gowns. And in fact, we will start receiving hospital gowns from the Montreal company Samuelson between now and the end of the month.
Some good news, something we haven't had enough of lately. As of today, Canada now has its first university in the north. Yukon College is becoming the new Yukon University. And as a cornerstone for this step, our government has already provided $26 million for a new science building. To everyone who helped make this milestone happen, congratulations. Not just for students, but for all of us. This is truly something to celebrate. Young people have the power to change our country for the better, and it's up to us to make sure that no matter where they live, they have the tools to chase their dreams and succeed. Today, more than ever, we need their vision and their creativity, because that is our path forward. Merci beaucoup.
Merci beaucoup, Monsieur le Premier ministre. On va commencer la période de questions par le téléphone aujourd'hui. Opérateur, c'est à vous.
Thank you. Merci. Première question, Michel Lamarche, TVA, à vous.
Monsieur Trudeau, d'abord une question
First of all, a question about the border. Was there more pressure from the provinces to maintain the closure of the border until June? And is it the same thing on the United States? Maybe an indeterminate closure of the border. Well, we have had a lot of discussions with the provinces over the recent weeks, and there was a clear desire to keep the current measures in place at the border. As you know, that is a source of vulnerability for all of us in terms of cases of COVID-19 coming into our country. So we will extend those measures, and the Americans were completely open to doing that for a further 30 days. Follow-up? Yes, I'd like you to comment on the reopening of businesses in Montreal. Do you have any concerns about what's happening in Montreal? And are you comfortable with the idea of doing some shopping in Montreal? Well, yesterday I had a conversation with a number of small business owners in my riding over the internet, virtually, of course. And what I heard from them are their concerns, but also their desire to re-engage and to gradually reopen their businesses. So I know that some businesses on the island of Montreal and right across the country will be making the right decisions, will be very careful. And of course, there are many consumers out there, even if they would like to be able to help their local businesses to thrive, they have some concerns. So this will have to be done very carefully to ensure that we can reopen the businesses safely and gradually. And I, too, would like to be able to go to various businesses in the coming days. But it's very important to continue to follow public health advice and practice physical distancing.
Thank you. Operator, next question.
Thank you. Merci. Next question, Kate Bolingaro, Bloomberg. Line open.
Hi, Prime Minister. So on this news regarding the border extension, I am wondering when exactly will Canada open its international borders, and do you foresee that there will be further extensions to this border closure beyond June 21st?
As we've seen, the decisions that we're taking are very much made week to week in this crisis. The situation is changing rapidly, and we're adjusting constantly to what is the right measures for Canadians to get that balance right between keeping people safe and restoring a semblance of normality and the economic activity that we all rely on. We're going to keep making those decisions as time goes on. It was the right thing to further extend by 30 days our closure of the Canada-U.S. border to travelers other than essential services and goods. But we will continue to watch carefully what's happening elsewhere in the world and around us as we make decisions on next steps.
We recognize that the situation is changing very, very quickly, and we have to make the appropriate decisions depending on the circumstances. Right now, it's important to extend that agreement and the current restrictions at the border for a further 30 days. But 30 days from now, of course, we will have further discussions and look at what else is happening around the world and what the situation is across Canada, and make the decisions that are right for Canada and appropriate at that time. At every step, we have to make the right decisions depending on the circumstances.
And just a quick question regarding the LEAF program. So it seems that it's been delayed now that we're leaving mid-May when it was supposed to be open. So I'm wondering, when will this rental subsidy program be unveiled, and what's the holdup?
We were pleased to announce a large employers emergency financing facility a number of days ago now. We're continuing to work with industry, with various partners to fine-tune the program so it's the right thing. It is designed to be a lender of last resort for many big employers. We know that big companies have greater access to capital than small businesses, which is why we helped small businesses right away and very generously. But large companies can access borrowed capital on capital markets around the world, and we hope they're going to be able to do that. But if they are unable to, the LEAF will be there to offer them support, to lend them money to get through this COVID situation. We're continuing to work with them on making sure that it rolls out as quickly as possible.
Thank you. Operator, next question.
Thank you. Merci. Next question, Marika Walsh, The Globe and Mail. Line open.
Hi, Prime Minister. Thank you. I'm wondering if you can tell us what your approach is going to be on Keystone XL. What, if anything, can you do if the Democratic candidate is going to cancel the project?
A couple of years before becoming Prime Minister, I went down to Washington to advocate for the Keystone XL pipeline. It has been a long position of mine that we need to get our resources to new markets safely and securely, and that's why I've always advocated for the Keystone XL pipeline. We saw the previous Democratic administration cancel it, and we will continue to work with whatever government gets elected in the United States to impress upon them how important Canada is as a secure and reliable supply of energy that they require, even as we move forward to a different future. Okay.
I have always defended the Keystone XL project. 2 years before I was elected Prime Minister, I went to Washington to drive home the message that Canadian energy continues to be used in the United States. And of course, I will work with whichever government is elected to remind that administration that Canada is a safe and reliable source of the energy that they require. But we will continue to show that we will move forward responsibly by working with our partners.
Yeah, so my question was, though, what you will do going forward. But I do want to pivot to Parliament. Andrew Scheer is calling for more in-person sittings. What is your position on how or when Parliament should return?
I think as with everything, we need to be cautious and responsible in how we reopen and restart all sectors of the Canadian economy. We understand that it is extremely important to have a strong democracy and strong institutions, not in spite of the crisis, but because of the crisis. And that's why we've been very pleased with extremely effective virtual sittings combined with in-person sittings over the past weeks that have allowed MPs from every corner of the country to participate fully in asking questions in the work that Parliament is doing. My concern is that as we reopen, if we reopen with reduced numbers without virtual sittings, there will be many, many MPs from further parts of the country who will be unable or unwilling to come to Ottawa because of their family's safety, and therefore there will be parts of the country that won't be reflected in our democratic institutions. We've put forward proposals that combine both virtual sittings and in-person sittings to continue the approach we have right now. We look to good conversations with other parties on figuring out that right balance as we move forward safely in upholding the importance of our democracy.
Thank you. Operator, dernière question au téléphone.
Thank you. Merci. Prochaine question, Mélanie Marquis, La Presse. À vous.
Merci. Bonjour, Monsieur Trudeau.
Thank you. Good morning, Mr. Trudeau. Now, what changes have been made to the arrangement between Canada and the U.S.? Well, for now, we are continuing with the exact same agreement. Of course, there are still discussions underway to determine whether other changes are needed or any adjustments are needed. But for now, it's the same agreement. Follow up? Yes, there's a provision in that agreement that has to do with sending back asylum seekers. Is that still in there? And do you intend to ask that provision stay in place. Yes, we are continuing with the same measures that were in place for asylum seekers for the next 30 days. Now, obviously, this is a situation we've been experiencing for a number of time. We've had irregular asylum seekers coming into Canada, and we have been seeking some way to resolve that situation that reflects our values and principles as a country, and also working in good faith with our southern partner. We are continuing our discussions on that, but at every step of the way, we will ensure that we are abiding by our values and our principles.
Hi, Prime Minister Tom Perry, CBC. As provinces start to reopen, testing and tracing is going to become more important. Now, we understand that that came up in your call with First Ministers. What have you offered the provinces and territories in terms of support on that, and what more can you do?
The federal government has put forward a proposal that recognizes that increased contact tracing and increased testing are going to be key to a reopened Canadian economy. We need to make sure right across the country that we have a strong capacity to respond wherever there might be a resurgence or flare-up of COVID-19, and that means having significant resources at the availability of all regions and provinces. So the federal government has offered to invest in a national framework to lead the way on testing and contact tracing. We are working with the provinces right now to ensure that it works for all of them, but we're going to be moving forward on ramping up massively our testing and our contact tracing. Okay. We know
that in a reopened economy, it will be extremely important to quickly respond if there's a resurgence of COVID-19 someplace in the country. So the federal government has decided that there has to be a massive ramping up of our ability to test and also to trace contacts that might have been infected. So we have offered to increase that capacity across the country, and we will be working with the provinces to ensure that that pan-Canadian approach can take hold. But we know that that will be absolutely critical in the days to come.
When things do start reopening, what kind of infrastructure do you want to see in terms of testing, in terms of tracing, I guess other things as well? What's it going to look like when we start allowing non-essential travel across the Canada-U.S. border?
These are ongoing questions. We've given ourselves another month before we have to have the right answers to those questions on non-essential travel. But even now, we know that we need to do more to ensure that travelers who are coming back from overseas or from the United States as Canadians are properly followed up on, are properly isolated, and don't become further vectors for the spread of COVID-19. We're working closely with the provinces to ensure that arrival of people into Canada, even now, but certainly once we get to a point where non-essential travel picks up again in the coming months, I guess, we need to have strong measures in place, and we're looking at those closely.
Bonjour, Monsieur le Premier ministre. Christian
Good
Noël de
morning,
Radio-Canada.
Prime Minister. Christian Noël, Radio-Canada. I want to take you to the international scene. There is a petition going around that say that Canada is not worthy of a seat on the UN, and some Canadians have signed that, particularly with respect to Indigenous issues and so on. Should Canada continue its campaign, and do you think that that will weaken our chances? Well, I don't think there's any real division on that. I think all Canadians want Canada to have a strong and reasonable voice on the international scene, and that's what we're always seeking to have. The Security Council of the United Nations is one means of ensuring that our values are shared and that we can push for more cooperation between countries and more multilateralism. And we can do that with a seat at the UN Security Council. But it is one way of pursuing our engagement with the rest of the world and not an end in itself. So with respect to people who disagree with our position on Venezuela, the dictator Maduro is illegitimate and is creating a humanitarian crisis in that country that is sending refugees fleeing to other countries in South America, and we will stand with our friends in South America and our allies there to seek a solution to this terrible crisis.
The UN Security Council seat is a means for Canada to continue its strong advocacy and presence for our values on the world stage. We know that there is a lot of reflection that needs to be had on how to handle this COVID-19 crisis and how to bring forward a better world in the coming years. I think when we reflect on the scale of this crisis, many people have compared it to what happened 75 years ago around World War II. Well, in the years following World War II, we created a range of multilateral and multinational institutions like the IMF, like the World Bank, the Bretton Woods institutions that helped the world over the following decades develop tremendous prosperity and opportunity for people right around the world. 75 years later, we have another crisis that is comparable in scale to that Second World War, and I think there need to be real reflections on how we move forward as a world, how we update and adjust our various multilateral institutions to better respond to the world we're becoming part of right now in a post-COVID era. Canada's voice is going to be really important, as it was around the forming of the Bretton Woods institutions, as it will be as we create a better, more prosperous, fairer world for everyone. And Canada having a voice at the UN Security Council will allow us to continue to be at the heart of those discussions as we move forward as a planet.
Could you be a bit more specific on that in terms of the role Canada plays in the global fight against COVID-19? And have you used this as part of your campaign? And there are some Canadians that are saying that they don't agree. There's no unanimity in Canada. How do you respond to that? Well, we have managed the situation in Canada quite effectively, but of course we can always learn from our neighbors and our allies around the world, including multilateral fora such as the G7, the G20, La Francophonie, the Commonwealth, and all the other ones. They are helpful in terms of our ability to understand and move forward safely, and also how we can work together on the next steps to defeat this virus. At the same time, it's important to reflect on the fact that this crisis we're now in is often compared to the global crisis that occurred in World War II. And in the years following World War II, a number of international institutions were created to guide us in the coming decades, and they have worked very, very well when it comes to creating prosperity around the world. Now, we have an obligation to think on what changes and improvements to those institutions are now needed so that we can move effectively towards the 21st century. And Canada should and must be part of those discussions, not only because we are managing our economy quite well in the midst of this crisis and reflecting our values around the world, but because the next steps when it comes to rebuilding a global economy and making a fair world, a more prosperous world for all, is something that Canada can speak to with a strong voice. And that's precisely why we are seeking another means of making our strong voice heard in these international institutions.
Morning, Prime Minister Kevin Gallagher, CTV National News. President Donald Trump is threatening to pull American funding from the World Health Organization and reconsidering his country's membership in that UN agencies. Now, some European countries have come to the support of the WHO. Where does Canada stand?
Canada believes that multilateral institutions like the WHO are extremely important, particularly at a time of a global health crisis like this one. No global institution is perfect, and there are obviously things we need to work on and things we need to improve about multilateralism, and that's one of the reasons why Canada has been so incredibly active over these past weeks and months, including in this crisis, to advocate for a rethinking and improvement of our global situations and our global institutions in line with our values. We will continue to do that. We will continue to support the WHO, even as we look for improvements to our multilateral systems.
China has actually pledged $2 billion for the WHO, and obviously leading up to this, the organization has faced criticism for its handling of misinformation at the beginning of this outbreak coming out of China. So are there any concerns for you that there's such a large influence in the term of funding commitment from China to the WHO?
I think there are always going to be reflections about the relationships between the largest donors to multilateral institutions and the functioning of those multilateral institutions. And I think as we move through this crisis and particularly come out of it, we will have to be asking questions about the independence and the strength of those organizations to be able to do the kinds of things that are absolutely necessary in keeping everyone around the world safe. That balance does need to be looked at carefully. There will be some real questions around China, of course, in the coming months and years that need to be answered, and we will be part of that.
Prime Minister Janet Silver, Global News. Earlier in your opening remarks, you commented on the Snowbird crash over the weekend. And I'm just wondering, have you since spoken to Captain Casey's family? Have they expressed concerns about the Snowbirds flying and whether or not you think they should be grounded?
I have had a couple of conversations over the past couple of days with the Minister of Defence, and I know he and others are very closely engaged with the families, and I will, of course, be speaking to the family of Captain Casey and others. I think there are very good questions being asked by a whole lot of people about safety right now, first and foremost by the RCAF, and there is going to be a proper investigation, and we're going to allow them to do their work before we make assumptions about what might be the outcome of that investigation. I
have spoken to the Minister of Defense several times over the past weekend about this terrible tragedy, and of course I will be speaking to the families involved. But for now, we need to allow the Royal Canadian Air Force conduct the investigation as to how this accident could have occurred, rather than jumping to conclusions about the safety of those aircraft.
To turn south of the border, President Trump says he's been taking the malaria drug Hydroxychloroquine for about a week and a half now, and he says it's a good preventive approach to getting COVID-19. I just want to get your thoughts on whether or not you think it is a good preventative approach.
I will continue to follow advice of medical professionals and implore every Canadian to follow the best advice of our medical health experts.
Merci. C'est ce qui met fin à la conférence de presse d'aujourd'hui.
Merci tout le monde.
All right, that is the Prime Minister of Canada on this Tuesday, just outside of his home. He is going to participate in the COVID-19 committee, which will kick off at noon. But lots of bits of news in that press conference from the PM today, specifically that the U.S.-Canada border will remain closed for another 30 days. It was set to expire in a couple days' time, and the Prime Minister said that there were concerns on both sides of the border to reach this agreement and keep that border closed to non-essential travel for another 30 days. I'll bring in my colleagues, Vashi Kapellis and David Cochran, to go through the other bits of news we heard there. The other headline was some changes to CEBA, that's the Emergency Business Loan, and I know you've been following that file closely, Vashi.
Yeah, and that's because, Rosie, we keep hearing from people who were not able to access that. This was one of the first measures rolled out by the government in concert with the wage subsidy program, and basically what it is a $40,000 loan. If you pay it back by the end end of next year. It's interest-free, and $10,000 of it, so a quarter of it, is forgivable. Huge uptake so far. I think you were saying 600,000 businesses have already accessed that. The process is fairly straightforward. You do it through your bank, and it's been pretty successful from most businesses we've heard from. On the flip side, and what the Prime Minister addressed today was right from the outset, sole proprietors, specifically ones who pay themselves through dividends or who hire contract workers that only work certain seasons, for example, or in a hair salon, if you're a contract worker there, were not able to access that money, which really is targeted at your fixed costs. So rent, for example, your bills, that kind of thing, because you can maybe use the wage subsidy, let's say. The parameters of it were that you had to have a payroll between $20,000 and $1.5 million. And again, that's why so many people felt like they were left out today. That basically is eliminated. So there are still some conditions, but if you are paying yourself through dividends, or if you just weren't able to access it prior to today, it sounds like you will be able to apply now. The details on the timeline were not provided at this point, but we'll pay attention to the briefing to see if they're made available there. And the other thing is that if you are a newer business, so you haven't filed a tax return yet, those are also people that we've heard from, and the Prime Minister said Minister Mary Ng, who is the Minister for Small Businesses, is working on a potential solution for that. So we'll pay attention to see if any information comes out on that, because I hear from a lot of those people as well. I think this is going to be very, very welcome news to a lot of sole proprietors in this country. I think there will still continue to be questions about why it took so long. And the reason I say that is because right from the first day, I remember the day it was announced very clearly, they were saying, wait a second, we need to access this too, please, please, please. It's been 8 weeks since then. It's good that it's finally here, but it did take a while. And I'll be watching, as I mentioned, for those specifics on how to apply and when, and what other conditions might be applied to that. But early reaction, for example, from the Canadian Federation of Independent Business, very much praising this decision from the government, very much welcomed by them.
Well, and an interest-free loan of $40,000 would be impossible to get, I would imagine, right now, having the ability to get right off 10 grand. But I would also think, Vashi, and just tell me from what you've heard from people, that getting any kind of loan, given the state of the economy and the risk that a bank might be able to take on right now, would be difficult for some small businesses.
Yeah, it does sort of depend on the circumstance of the business, but that $40,000 number from people I've heard from, the accessibility of it, the fact that it's come very quickly. You apply, it's a super easy process apparently through your bank, and it comes quickly, has been a success and very welcomed by them. But yeah, getting money from your bank right now, the sort of risk assessment is different than it would be in normal circumstances. We know that it's not been easy for bigger businesses, and that's part of why the federal government announced a loan program that hasn't opened up yet, but will be made available. Small businesses are certainly, I mean, if they have the choice to take an interest-free loan versus one where they're going to have to pay some interest, my guess is they're going to go for the former. Just quickly, I would also mention the rent program, the commercial rent program. We're still anxiously waiting for details on that. I keep hearing from small businesses about that too. It's supposed to apply to April, May, and June. This is the federal provincial program that would subsidize rent through the landlords. It's supposed to apply to April, May, and June, and there's some details out through the CMHC, but the government hasn't been able to confirm them. Those details haven't really been formalized, so a lot of landlords still not sure if they're going to participate. The last month it applies to is about 11 days away, so anxiously waiting, I think, for details on that too.
And another one of those cross-jurisdictional programs, so sometimes those tend to be more complicated, as we've seen. David, so the other announcement there around the border, I suppose not surprising, but perhaps a relief to people who may have been worried about still seeing the cases in the United States and realizing that opening up the border in any dramatic way right now just doesn't make a lot of sense.
Yeah, this is not a surprise, I don't think, for people who've been paying attention to what's happening on both sides of the border, still with transmission issues in Ontario and Quebec and, of course, all over the United States. Interesting, though, the Prime Minister, in answering some of the questions, he's talking about the border closing down, but also looking ahead to when the world starts to open up, in questions about the bid for a seat on the UN Security Council and the process of reflection that he hopes the international community is going to go through on things like strengthening the World Health Organization and changing how our major international institutions operate post-COVID-19, comparing it to the post-Second World War era with the Bretton Woods Conference in New Hampshire in the United States, which led to the creation of many of the international institutions that sort of guided the stability and peace after the Second World War, and whether or not there will be that sort of spirit of enhanced multilateral cooperation after all of this, given what we've seen sort of in the rise of isolationism and nationalism in places like the United Kingdom, Russia, the United States, China, and tensions in international trade conflicts and the tightening of borders, when we do get to a point where we can loosen borders, after the health risk diminishes, if not goes away, what sort of a world are we going to left with? So this is something the Prime Minister has clearly given some thought, and we've seen the readouts from his office of all of the international leaders he is speaking to on a daily basis as we get closer to the vote on the seat on the United Nations Security Council that they've been campaigning for since the first term in office. So interesting to see the Prime Minister give some insight into how he views what Canada's role could be in a post-COVID-19 restructuring of the international order, beginning with the improvement and the reform of the World Health Organization. Canada not following the United States lead of yanking its funding and wagging its finger at the World Health Organization, instead saying there needs to be a clear investigation and an inquiry into exactly what happened, but leaning more to the side of strengthening and fixing the World Health Organization instead of burning it to the ground as some would have him do.
Yeah, interesting that Canada's, I mean, obviously this government is a big proponent of multilateralism and multilateral organizations, but interesting that I agree the Prime Minister seems to be suggesting that that is indeed part of maybe a stronger argument for why Canada should in fact win that seat at the Security Council, that it could play that role maybe in a way that is more needed given what we're living with right now.
Yeah, and he talked about that. So that's his international agenda. And then on his domestic agenda, Rosie, a question Tom Perry, our colleague, asked him about the proposal he's made to the provinces about ramping up domestic testing, saying that the federal government is prepared to invest in a national framework on testing and tracing. Interestingly enough, the approach by the federal government, by and large, has been to allow the provinces to make decisions in their own jurisdiction and sort of acting as like a banker and a backer as needed. But we have not seen the testing and tracing get to the level I think the country would like it to be, and people would like it to be, particularly in places like Ontario and in Quebec, which is the epicenter in this particular country. And the Prime Minister now saying, we are here and we are going to aggressively ramp up and we want to invest in this. Now, they're going to need to get the provinces on board, and jurisdictional issues are always going to be a thing there. But a very forceful message from the Prime Minister there that they want to move on this, they have the money to move on this, and certainly declaring in a very public way that they have the intention to move on this. So I think this week, when he has his weekly call with the other First Ministers, that may be a chance to put some momentum behind this particular idea. As you know, the officials will be dealing with this on a fairly consistent basis, trying to figure out what that would look like.
Yeah, it looks like the testing in Ontario today has dropped back down to numbers that that the government will not want to see. Maybe that's just a delay because of the long weekend, but we'll have to see. Okay, I will come back to both of you. Thanks so much. As we've been talking about the economy reopening, it is some reopening across big parts of Canada today. British Columbia, Saskatchewan's moved into another phase. Ontario, they're all freeing some of the reins on the economy. So let's speak to a couple of those business owners now. In Toronto is Rami Hila Lee, who owns a clothing store, and in Vancouver is Dr. Kumar Shivdarasni. Hopefully I got both of those. You tested both of me, gentlemen, today, so thank you for being here. I'm going to start with you, Rami, if I can. So you own a t-shirt store, a cotton store, if that's right. You're the founder of Cotton, a retail clothing business, and you could reopen, right, if you wanted to right now, but you're not going to. So tell me what your thinking is there.
Yeah, so we've given this a lot of thought. I mean, we have stores in Vancouver, in Toronto, and Montreal. So we want to make sure that, you know, when we're putting out decisions, we're taking care of our employees and our customers across all of those locations. So we aren't opening just yet until we see a little more, kind of see what the businesses that might open today and might open in the coming days do. For us, we are planning on opening June 1st, and that opening is going to be curbside pickup and by appointment. We're going to start by appointment to just try to limit the number of people in the space, give our employees kind of time to figure out what this new reality looks like, and then work our way up from there.
Do you have what you need in place to do this, like plexiglass or PPE? Do you have those kinds of things ready to go, or do you need more time to get those too?
So yeah, that's a part of it. I mean, this announcement came, you know, last week. Some of the provinces were the week before, so not too much time for us to really be able to ramp up and get the procedures in place. To be honest, for the last, 8 weeks, 10 weeks, whatever it may be, we've been in a little bit of a hold pattern here, trying to figure out what this is going to look like and what this new reality is going to look like. And, first and foremost, the safety of our team is paramount. So that's kind of what we're prioritizing. So yeah, just like you said, we're we're putting those places and pieces in place now to be ready to go June 1st, July 1st, whatever that ends up being for us.
And how has your business been doing? I don't know if you have an online component, probably, but how have you been doing given the shutdown?
So we're a primarily online business. So for us, that piece of our business has continued to exist and has had little to no disruption. Retail does make up a piece of the puzzle for us, which has definitely been difficult. But I mean, this is a difficult situation for everyone. The retail industry in general has been especially hard hit, as well as the hospitality industry. So the physical components definitely been difficult. Our online business has seen some increase, kind of, I would say, it hasn't made up for the decrease in retail, but it definitely, some of that overflow from physical retail has gone to online. But obviously we've been closed for close to 3 months now.
Have you had to, or will you tap into any of the government programs, whether it be the wage subsidy, the rental offer, the business loan that we were just talking about there?
Yeah, so we've tapped into the business loan. We were able to tap into it kind of in the second go. I know they made some adjustments to the size of the payroll, so we were able to tap into that. The wage subsidy right now, we're working through that. I know that many members of the kind of startup high growth community have spoken about, originally when they were saying year over year, that excluded a very large portion of employers, or a significant portion of employers that had been growing past that 30% clip. Whether we are gonna qualify for that, we don't have a final determination there yet. And we do qualify for that 10% piece that they announced early on. So we have taken advantage of that.
Do you think that this has happened at the right speed? I mean, it's hard to know, obviously, but Ontario, because the cases have been so numerous, obviously it's gone a little bit slower than in other parts of the country. Are you comfortable with what the province has come up with here in terms of reopening?
I think that for Ontario specifically, the numbers are still going up. I don't think the testing and the tracing is where I think a lot of people would like it to be. So that's why we're cautious. We're just taking this more cautious approach, delaying the opening a little bit. And when we do open, we're going to make sure that we limit the number of people that we can have in our spaces and really react from there. Like you said, our other location, or one of our other locations in Quebec, which is the other part of the epicenter of all of this in Canada. So those two places for us are, we're keeping a very close watch over that. And then Vancouver's a little better, but again, not far behind. So.
And you have a store in New York, do you?
Yeah, we had a store in New York. We were actually about to sign a long-term space there right before this all happened. So we have put a pause on the expansion in New York for now, and we'll circle back once hopefully things go back to normal.
Okay, Rami Hilali. Hope I said that right, Rami. Thank you so much. Nice to meet you. Okay, good luck with everything. Appreciate your time. He's the co-founder of Cotton, a retail clothing business. All right, let's go to our next guest because BC is entering phase 2 of its reopening plan today. That means a large range of businesses, including some medical service providers, can open their doors. And Dr. Kumar Shivdarasni operates a skincare center there. You're going to correct me, doctor. I can see it already.
I do it often.
Okay, well, forgive me.
Like the cool,
Shivdasani. All right. That's much easier. All right, Dr. Shivdasani, you are opening today. Tell me how you've prepared.
Well, my time at the hospital, I had a sense that this was not going to be business as usual when we opened up again. And so we were able to procure, PPE, and we've not even announced our opening. We wanted to really go into it slowly. And so we've had clients booking in and contacting us, and we've been booking 15 minutes additional in between every client, every patient, to allow for cleaning, to allow for fewer people in our waiting area. We have a large waiting area to begin with, but we are slowing down the patient flow. We built another treatment room as well. Wow. To allow more space to be treated. I've hired more staff. We're expanding our hours, again, in order to not have as many people in the space at once.
I would imagine because you're a skincare center, though, you had a lot of things that other businesses are trying to understand right now, whether it be PPE or equipment needed to disinfect. Has that given you a bit of an advantage?
Yeah, I mean, we I remember being at the superstore buying the hand sanitizer for my clinic, and we had these. I'm going to show you one. We had these big. I saw a bunch of these. Back in January, and I thought, I don't know how many I need. Maybe I'll just get a few. They're the color of my clinic, so I'll just get a few anyway. But I mean, we were buying quite a few, and like hand sanitizer, gloves. We have a cleaning service that comes in to clean. We sanitize our equipment between clients, between patients anyway. Mm-hmm. So much of what we were doing already. I mean, we didn't tend to necessarily, my laser technicians, will now be wearing face shields, which we didn't typically wear. We didn't typically wear goggles. So these were kinds of things that needed to be sourced out and obtained.
Are you worried about your safety or your staff's safety, given, as you say, the proximity of the work that you have to do on your clients and your patients?
Worry isn't. I don't think worry quite works for me. I think we're prepared, and we've done absolutely everything to really reduce the risk of protecting ourselves and our patients. Short of just not seeing anybody ever again and just staying in my own home, and I think this is. I feel pretty. Confident. We've taken all the measures suggested. We're instituting, questionnaires. People are, before they get to confirm their appointment, we're sending them questionnaires to document. Have you had symptoms? Have you been near anybody who's tested positive? Have you been traveling? And then we'll be questioning them again as they come in the door. We've got hand sanitizer everywhere. Like we're doing. Really seeing patients experience COVID-19, and people and I've been listening to the Prime Minister every morning on his daily report. We've had Bonnie Henry speaking to us in BC every afternoon, and we talk about this social distancing, and it's not been. I mean, it's physical distancing, of course, but the sense of, I don't know. I've really enjoyed this. I've never felt better, being a Canadian, listening to the Prime Minister, listening to Bonnie Henry, us coming together to work, to come through this together. I've been in touch with many colleagues in my business, just doctors in general. I work at the hospital, as I said, and they were really, kind enough to, working together. And then, there's been such camaraderie and coming together, helping each other to do this, and as difficult and even scary as times are, I think it's really it's us working together and helping each other that's really gonna get us through this, and it's really made me determined to do better for my patients.
Well, that's a lovely reflection to end on, Doctor. I appreciate you making the time. And again, my apologies for not doing a great job with your name, Dr. Kumar Shivdasani. There we go, Shivdasani. It sounds like you're doing a lot of things to get the center reopened and protect your patients and your staff. I appreciate you making time for us today, Doctor.
Thank you.
Okay, nice to meet you. All right, as we wait for our regular briefing that happens at the top of the hour with federal cabinet ministers and public health officials, I'll bring back Vashi and David. I am terrible at names that are difficult, and both of those gentlemen tested me, but both of them had really interesting stories about either the amount of thought process that goes behind reopening a skincare center, as you saw with Dr. Shivdasani, or in the first gentleman's case, a retail store where you don't feel like you're ready and you feel responsible for protecting everybody. It's a lot of work that these smaller businesses and larger businesses are having to do to get ready for the reopening of the economy that we would all like to see in some way, but knowing that they have the onus is really on them to make sure that their businesses are well prepared for this, Vashi.
Yeah, that's a really good way to put it. And I think also both those stories to me were emblematic of some of the regional differences in this country right now, which were always there at the start of this outbreak, but I think have been accentuated even further in the past week and in the coming weeks. Insofar as, take BC, 8 cases, I think, announced in each of the 2 days. Like yesterday, they announced 16 cases, and that was over a 2-day period. We're looking at triple digits in Ontario still, a lack of testing today, and sort of inconsistencies when it comes to testing. It's supposed to be at 20,000, and it very, very rarely is even close to that. I think you got that sense from the first business owner who was talking about reopening at least part of his operation in Ontario, and the sort of nerves that those businesses feel. Toronto Mayor John Tory last night even talked about, who's supposed to be taking care of this PPE? Is it incumbent on the government? Is it the business? Does it have to be some sort of partnership? Nothing is really set in stone. And I hear from a lot of businesses who are having some difficulty navigating that. In BC, obviously a lot of the responsibility falls on businesses, but they are dealing with a very different situation right now. They're opening restaurants today at 50% capacity with very specific rules. They just extended the order here in Ontario for another 2 weeks that limits gatherings till the end of May rather, to 5 people. So I think for me it accentuates the regional differences, and it also accentuates, I think, some of the issues behind a lack of congruency or a lack of consistency when it comes to what do I need in order to reopen safely.
Yeah, and David, it sort of speaks to what you were talking about before, the need maybe for some sort of national piece on the testing and tracing, because obviously each province is struggling in different ways, and that then trickles down to the rest of us who are trying to navigate this too.
Yeah, until the country has a real robust system of testing and tracing, there isn't going to be a lot of certainty, right? And to build on the BC example that Vashi just talked about, Bonnie Henry kind of said it really well yesterday when she said, it brings about 3 A's is the way I'm going to describe it: anticipation in the reopening, but also apprehension and anxiety. And that's the challenge for a lot of people as we go into this great unknown of what does a reopening look like and how safe is it. And the other challenge is the supply of businesses will be there more and more as the reopenings happen. Will the demand be there? Will people feel comfortable enough to go out shopping and take avail of these services now that they've gotten used to cutting their own hair at home, or having everything delivered to their house or picking it up at curbside? There is still an uncertainty there that needs to be overcome.
Yeah, and that's part of what these businesses are trying to do, is shore up some of that certainty. Okay, both of you, we're going to take a short break. Thank you so much for your help. We'll see you on the other side of this break. We are standing by at this hour for the federal cabinet minister's briefing. More details on the Canadian Emergency Business Account loan program that the Prime Minister announced has widened a little further to capture some of the people that it had left out, and also confirmation this morning that the U.S.-Canada border will remain closed for another 30 days to non-essential travel. We'll have more right after this short break. I'm Rosemary Barton. You're watching CBC News Network. Hi again, I'm Rosemary Barton here in the nation's capital. Thanks for joining us on CBC News Network and streaming wherever you might be around the world on our website and our app. This hour, lots of news coming from the Prime Minister after his daily pandemic address today. Canada's border restrictions with the U.S. will remain in place for another 30 days until June 21st. The agreement was set to expire this Thursday. The Prime Minister also announced the expansion of federal support for small businesses through the Canadian Emergency Business Account. That allows for interest-free loans. So far, more than 600,000 businesses have already applied and received loans under that program. Now it has been expanded to include some other people that had not been captured in the initial criteria. And of course, we will bring you through the day your COVID-19 updates from government leaders and health officials across the country, no matter where you are, including any moment now, federal cabinet ministers in this city, as well as federal public health officials. After many, and we've talked about it so many times here, COVID-19 related deaths in long-term care, Ontario has just announced an independent commission. The Minister of Long-Term Care says her government is seeking changes to better protect the lives of residents and staff. And the CBC's Mike Crawley joins me now from his home in Toronto. Okay, what did the Minister have to say about this, Mike?
Rosemary, Marilee Fullerton, the Minister, announced this, that it will begin in September, an independent, nonpartisan commission, but there's not a lot of details about it, no terms of reference yet, no idea who's going to be on this commission, what's sort of a time frame it will report on, other than the government said that this is the quickest way to get some answers. She was questioned about it in question period this morning, and here's a listen to what Marilee Fullerton had to say.
We cannot lose more time. Our government has been working since the onset to look at staffing, look at capacity, look at wait lists, expert panel for staffing strategy. We have been moving decisively and swiftly because Ontarians deserve it.
And now this actually falls short of what some people have been asking for, notably the opposition. They've wanted a full, independent public inquiry led by a judge with a full mandate to explore everything around the long-term care system. Ontario has had public inquiries on things like SARS, on Elizabeth Wettlaufer's killing of 8 people in long-term care homes. There have been 1,600 people die of COVID-19 in long-term care homes in Ontario, and so this is not a full public inquiry like was held into those other events.
Yeah, it would seem as though that perhaps the government was forced to make some sort of announcement, Mike, because there was a lot of pressure, not only from opposition parties, but really from the public writ large. And you have to wonder whether the mandate too might change if people don't feel satisfied with what the terms are that they announce, or even who's heading it up. But what kind of reaction are you hearing so far?
Yeah, I mean, for a lot of people outside the system, what's the difference between an independent commission, a public inquiry, a review? It sounds like it's semantics, right? But yeah. The NDP clearly has been pushing for an independent public inquiry because the Ford government has held what they called independent commissions in its 2 years since they've been in government. And the last independent commission that the Ford government had was looking into the finances of Ontario, and it came up with a number that said that the previous government had left a $15 billion deficit, which was the number the government kind of wanted it to uncover, and it was later proved to be not true. So there are some questions of whether this is really just an attempt, when our opposition independent MPP said it's smoke and mirrors, really. Andrea Horwath, the leader of the NDP, she spoke today in question period as well.
No one has asked for yet another Ford government-controlled commission. We owe it to the thousands of staff and residents who lost their lives to get to the bottom of this. We owe it to their family members, to their friends, to their communities.
Lots of people with lots of questions about how the virus was allowed to get into Ontario's long-term care homes, at a time when they knew the pandemic was coming. Most of those deaths, Rosemary, happened after the end of March, when Premier Doug Ford said, we're putting an iron ring around seniors in Ontario. So it's curious as to why so many staff developed infections and so many residents. Thousands of residents came down with COVID-19 infections, and 1,600 people have died.
Yeah, and we certainly know the federal government, too, very much wanting to have a conversation about how this unfolded after it's over. Mike Crawley in Toronto, thank you so much for that. Appreciate it. All right, I will bring back my colleagues now, the host of Power and Politics, Vashi Kapelis, and the CBC's David Cochrane, as we wait for public health officials here and cabinet ministers. Maybe we should just pick up where David, Mike left off. Those 2 days off have fried my brain. I think that the pressure on governments, first probably at the provincial level, because it is their jurisdiction, will be intense to start to get answers for people on what could have been done better, what went wrong, and what the problems were, whether it was staffing, infrastructure, or funding. I can't imagine this is the only independent commission or inquiry we will see about long-term care centres in this country, Vashi.
Yeah, and the question is, will there be one at the federal level as well? It sounds like obviously in Ontario there's going to be something, although to Mike's point, it's not exactly what the opposition wanted looking back, and we won't have to wait forever for the results of that, or at least that's their intent at this point. That's what they said today. But there are big questions in Quebec as well. There are questions in Nova Scotia. There are questions about continuing care in certain parts of Alberta as well. Most of us have been looking to the model of BC, which the government there acted a lot earlier on some of the conditions it placed on those long-term care homes. But those conditions still sort of underline some of the major issues within many of them in this country, insofar as they limited the number of homes that someone could go to, so you could only work in one home. Well, why are people working in more than one home? It's because they don't make enough money at just that one job. And pay of people who work in these homes has been sort of something we've seen in many different provinces, which again points to the possibility of, or the prospect of, the federal government looking into this. The other thing that a lot of provinces are talking about, and they have been, to be fair, for years, is more money from the federal government in health transfers. They have asked for more. The escalator was sort of kept to what was promised by the previous government, which was to the disappointment of provinces. The idea that's been floated is, will the federal government have a certain pocket of money to increase funding for long-term health care in this country, but alongside that pocket of money, will there be strings attached? And I've had the opportunity to interview a number of premiers over the past few weeks about the prospect of that, and I can tell you that most of them are none too pleased with that idea. They're obviously very protective of their jurisdiction over long-term care, but I do think this will come to a head probably on the other side of the acute phase of this pandemic, and there will be big questions from the federal government if they're going to hand over more money, which might be very necessary, about what kinds of strings they could attach to that money. And I think that already premiers are resisting that, but depending on the outcome of commissions like the one Ontario just designed, they might not have a choice.
And to be clear, that's the strings attached thing is nothing new to federal governments and provinces. With wait times, for instance, in healthcare, it has been done before, and provinces may not like it. But if Ottawa's bankrolling a fix inside the healthcare system, they might have the right to demand certain issues. I'll just give you 30 seconds there, David.
Yeah, I mean, strings attached, not a new thing. Complaining about strings being attached, also not a new thing. Often they get to a negotiation at the end of it where they take the money and the strings because they want to make sure that there is an expansion of health services available for the people that they represent. We saw this with a mental health strategy recently, for example. The provinces always want to pour it into the base escalator transfer. The feds say that often gets eaten up by salary increases and things like that, and not an actual expansion of services. So they want to make sure that happens here. But to touch on one quick point, what Vashi made about the workforce in these long-term care homes, people working in multiple homes, it's not just because they don't get enough hours and make enough money. It's because they're often hired part-time, so they don't have to be paid benefits.
Yes,
this is something you need to look at, because you have people making minimum wage, and as we've learned, taking maximum risk by going into these facilities. The whole labor situation in these homes needs to be looked at, as well as the governance.
Okay, thank you both very much. I'm going to now take us to our briefing, our daily briefing by federal ministers and public health officials. This is the president of the Treasury Board, Jean-Yves Duclos.
Medical Chief Officer in Chief,
Minister of Small Business, Export Promotion and International Trade, as well as Minister Anand, who is from Minister of the Department of Public Services and Procurement, Canada. Dr. Tam.
Hello everyone, good afternoon, and bonjour à toutes et à tous. As usual, I will start with the latest numbers on COVID-19 in Canada. There are now 78,499 cases, including 5,857 deaths, with 39,498 cases, or 50%, now recovered. Labs across Canada have tested over 1,337,000 people for COVID-19 to date, with about 5% of these testing positive overall. We are now testing an average of 26 to 28,000 people daily, and these numbers change quickly and are updated regularly on Canada.ca/coronavirus. Before I begin, I also want to offer my sincere condolences to the Canadian Forces Snowbirds team, who tragically lost one of its members, while another was seriously injured in an accident this past weekend. As they toured across Canada to lift our spirits in the face of COVID-19, we now turn our thoughts towards them with sympathy and shared sorrow. My reflection this past weekend was on the strength of unity among Canadians. Thinking about how much we've all been through this winter, I'm heartened by the resilience of Canadians as a collective. This is not to minimize what we've been through or the difficult path that still lies ahead. It is just a feeling of confidence that we've got what it takes because of the ingenuity, unity, and caring that I have witnessed. We've all been waiting to get outdoors and enjoy a bit of warmer weather, and I hope this past weekend was a chance to do that. I know it is a bittersweet opening up of our outdoor socializing spaces because we still need to practice restraint. Some areas where COVID-19 is still active need to be extra cautious. But everywhere, we still have to maintain the basics of physical distancing and limiting our socializing to core bubble of contacts. The truth is, even with slow growth of the epidemic, we are not out of the woods. No country is. We know there is no certain path away from COVID-19 and that the only safe route is the one we take together, with cautious and calculated steps forward. This will be a summer of more restrained movements and virtual celebrations than we're used to. But to keep the curve down, we've got to keep our public health practices up. That is the only real certainty, and that is why we've got to hang on to this safety rope and not let go. Throughout, I have seen the sacrifices Canadians have made to protect our health system and prevent even more illnesses and tragedy from befalling us. But it is the way Canadians have done this with collective generosity, kindness, and ingenuity that assures me we will give what it takes and get through this together. Thank you. Merci.
That's Dr. Theresa Tam with her daily update. If you want to continue watching this briefing, you can go to our website, cbc.ca/politics. But we want to show you something else happening right now. The Special Committee on COVID-19 is meeting via video conference. Oh, look, the Prime Minister is in his actual office in West Block. We will listen in live to those questions and answers now.
The Canadian Security Establishment has warned that intellectual property that Canadian health organizations are developing associated with researching vaccines and treatments and tests for coronavirus are valuable targets for the Chinese Communist Party-backed hacking. Has the Prime Minister or any member of Cabinet been made aware of any cyber breaches?
The Right Honourable Prime Minister.
Mr. Speaker, as a government, we take extremely seriously the safety, security of Canadians and of our intellectual property. That's why the Canadian Security Establishment continues to do extraordinary work in keeping Canada and Canadians safe. We receive regular updates from the CSC and from all our intelligence agencies on what we can do and what we continue to do to ensure that Canada is protected.
Ms. Elizev.
Well, Mr. Chair, the Canadian Securities Establishment has indicated that there is a heightened risk and increased measures are needed to protect Canadian national security interests at this time. Could the Prime Minister let us know what additional measures the government is taking to heed these increased warnings and protect Canada?
The Right Honourable Prime Minister.
We have over the past years increased the resources available to the CSC because we know how important it is to constantly be remaining vigilant and protecting Canadian networks, Canadian institutions, and the safety and security of Canadians from cyber intrusion and cyber attacks. We continue to ensure that our national security agencies have the tools necessary to do what is needed to be done.
Ms. Elizev.
Thank you, Mr. Chair. Canada is a member of international organizations like the WHO because we expect to receive accurate and timely information that enables us to make decisions on the actions we need to take to keep Canadians safe. But if the WHO doesn't validate and verify that information that they share with member states, it puts us all at risk. over the weekend, the International Development Minister said that it's not the WHO's responsibility to question the information provided by China in this pandemic. Right from day one, Canada has made bad decisions based on bad information from the WHO. The crisis is not over. Is the government continuing to trust without verifying the information from the WHO?
The Right Honourable Prime Minister.
Mr. Speaker, Canadians well know that this is a global crisis that is hitting locally in every country around the world, and we need strong global institutions to be able to counter this, and that is why we continue to support the work of the WHO. However, as we go through this, it is clear that there will need to be improvements to the WHO, to the international institutions that serve us, and Canada will be there, as we have been there, in asking questions and demanding answers.
La prochaine question sera posée par Monsieur Sainte-Marie. Monsieur Sainte-Marie.
Oui, merci, Monsieur le Président. Le 11 avril dernier, la Chambre a adopté une motion qui ordonnait au gouvernement de mettre en œuvre à court terme des mesures de soutien aux PME pour couvrir leurs coûts fixes. Qu'a fait le gouvernement?
Premier ministre.
Par rapport aux coûts fixes, on reconnaît d'abord que les plus grands coûts par beaucoup d'entreprises, c'est la masse salariale. Et donc, par rapport à la subvention salariale, on est allé de l'avant. On a aussi amené des mesures pour le loyer.
Oui,
Mr. Sainte-Marie.
La masse salariale, en effet, c'est important.
Yes, payroll is important, but that's not a fixed cost. So once again, I'd like to ask the Prime Minister, what has the government done to help businesses with fixed costs pursuant to the motion adopted by the House? And I wouldn't mind if you took longer than I took to ask my question. The Right Honourable Prime Minister. Thank you, but I will try to be brief. We have implemented measures to help with commercial rent. This is an important and a significant cost for many businesses, and we're working closely with provinces to ensure that we offer support to businesses to help them with these fixed costs, including commercial rent. Mr. Sainte-Marie. Mr. Chair, the rent assistance program is not working. The CFIP is asking for this program to be overhauled significantly. For example, the requirement of having lost 70% of revenues is excessive and is going to leave many SMEs behind. And this program leaves behind SMEs where the owner does not have a mortgage, as well as chains. And when SMEs try to qualify for the program, they need the owner of the building to collaborate, and that's not always the case. According to the Quebec Retail Council, 40% of businesses that would be able to apply to this program say that the owner doesn't want to participate. Has the government evaluated the effectiveness of this program? What is the government going to do to make it truly accessible? The Right Honourable Prime Minister. From the very beginning, we have brought forward programs to help. And as we're watching the impact of these various situations, we are trying to close any gaps in the program and improve the programs. And we're continuing to review the program to see how we can strengthen and improve it. At the same time, we in the Liberal Party, we recognize areas of provincial jurisdiction, and we will work closely with provinces or the relevant jurisdiction in areas such as rent. So we will work closely with Quebec and the other provinces.
In terms of provincial jurisdiction, the Quebec's Minister of Finance, Éric Girard, does not agree with the Prime Minister, and he said the program was announced by the federal government and its administration is completely under the CMHC. This is not at all provincial. Chair, the Quebec Restaurant Organization surveyed its members, and 2/3 said they are very or extremely concerned about paying their rent in coming weeks. In terms of rent support, according to this survey, at least 1 out of 4 restaurant owners will have a hard time signing up for this program. What is the Prime Minister going to do? The Right Honourable Prime Minister, we established programs to help small business workers, Canadians, families that are facing great challenges during this crisis. And this is why, as the situation evolves and as we understand where we need to make improvements, we are tweaking programs. We are looking at alternative mechanisms and small businesses. We're going to work with landlords as well. We know there's always more to do, and we're going to be there for entrepreneurs and small businesses. Mr. Sainte-Marie, a 30-second question or less, please. Well, SME fixed costs go beyond rents for many sectors, such as hotels, hair salons, and even zoos. What is the government going to do for fixed costs for SME aside from commercial rent support? The Right Honourable Prime Minister, in 3 seconds or less. We this morning announced an expansion of the $40,000 loan program for small businesses who were not eligible. Now, small businesses that have employees that are contractors or business owners that are sole proprietors will be able to have access to this $40,000 loan, and this will help them with fixed costs. Thank you.
Next question goes to Mr. Julian. Mr. Julian.
Thank you, Mr. Speaker. Canadians are suffering during this pandemic, but some very wealthy are profiting. During World War II, there were laws against profiteering, but this government seems to be providing incentives for profiteering. First, we talk about the corporate bailout program LEAF, which is open to companies that use tax havens, which is over 90% of Canada's largest publicly traded companies. Why didn't this government shut the door to LEAF to all companies that use tax havens?
The Right Honourable Prime Minister.
Mr. Speaker, as a government, we have increased substantially the resources available to Revenue Canada to go after tax avoidance and tax evasion in the billions of dollars, and we will continue to do exactly that. We have no patience for those who don't pay their fair share of taxes as a government or as a country. At the same time, we are needing to make sure that we are supporting workers across the country, whether they work for large companies or not. Perhaps the NDP is willing to put aside the workers, the tens of thousands of workers in Canada's 90% of the largest companies. We are not. We will continue to be there for Canadians.
Mr. Speaker, not a single company listed in the Panama Papers, no companies listed in the Paradise Papers, not a single company involved in the Isle of Man scam have ever been charged, let alone convicted, of tax evasion. They can all get the Prime Minister's corporate bailout. Now, Denmark and France and other countries have banned tax haven companies from getting bailouts. Why hasn't this government done the same?
The Right Honourable Prime Minister.
Mr. Speaker, as a government, we have taken very seriously the responsibility of cracking down on tax avoidance and tax evasion and ensuring everyone pays their fair share. But if the NDP really wants to continue on this approach, they should start naming companies that they feel should not be eligible and explain to their workers why they don't qualify for the help that other Canadians get. We need to work first and foremost on supporting workers, but if the NDP wants to start listing companies who workers shouldn't be helped, please go ahead.
Other countries have done it, and the Prime Minister, with respect, should be doing the same thing. Now, there's the big banks as well. In the last economic crisis, the Harper government gave over $69 billion in largesse, as the banks racked over $27 billion in profit over the same period. Now, this government is going even further, approving up to $150 billion in support to Canada's big banks. The banks can and do impose penalties, fees, and interest on any deferrals they approve, and they're benefiting from near zero Bank of Canada rates. The government has tools to cut the banks' profiteering. Why don't they use them?
The Right Honourable Prime Minister.
Again, Mr. Speaker, we see the NDP being long on rhetoric and attacks, but short on specifics. They will not name the companies that they don't think employees should be getting benefits like other Canadians because of the companies they work for. And I'm still waiting for the NDP to start naming companies who shouldn't receive the LEAF. On the other side, we will continue to work with the banks who have made strong measures to support Canadians and will be doing more in the coming months. We know we need to to work together to get through this, and that businesses, large and small, are part of the solution in this country. We will keep working with them for the benefit of all Canadians.
Mr. Julian.
Mr. Speaker, they haven't used a single tool, and people should come before profiteering. It's time the Prime Minister understood this. Now, Amazon is owned by the world's richest man who's made an estimated $30 billion off the backs of Amazon workers during this pandemic. Amazon has announced it's cutting wages at the end of this month. And Amazon's on the dirty dozen list of most dangerous employers. But instead of defending workers, this government is helping Amazon with public money. This government has given Amazon a sweetheart contract to take over from our post office and our federal emergency warehouses. Why support Amazon's profiteering with public funds?
The Right Honourable Prime Minister.
We know how important it is to get personal protective equipment out to places across the country that need it quickly and urgently, and that is why we're working with Amazon Canada as a distribution space. But there's a company, perhaps the NDP is suggesting that Amazon Canada employees shouldn't be receiving benefits from the government. We think that employees, regardless of the companies they work for, large or small, should be getting the help that they need, and we're ensuring that the help that goes to companies goes directly to employees. Those are the things with the wage subsidy and others that we are focused on to make sure that Canada can come back strong, both health-wise and economy-wise, once this is through.
Okay, we're going to pull away now from the COVID committee. We usually just take the leaders round there. The question and answers to the Prime Minister. We'll go back if there are more, but we will take you now to the federal briefing with ministers and public health officials. Back to that. That was the Minister of Procurement, and we are going to go back to the President of the Treasury Board. I believe they'll take some questions too. Let's listen in live.
For the Canada Emergency Business Account, 6,000 companies are already benefiting from this program. Also regarding medical equipment supply, and an announcement regarding a 30-day extension regarding the border measures with the Americans. And we will now be pleased to answer your questions. Thank you, Minister.
We're going to start with 3 questions on the phone and then turn to the room. 1 question, 1 follow-up. Operator, over to you.
Thank you. Merci. La prochaine question est de Hélène Buzetti de Le Devoir. La parole est à vous. Oui, bonjour.
Question from Le Devoir. I don't know if one of you might be able to answer me, but it regards the operations of Parliament. Will it continue to sit? Because many sitting weeks were missed, I was wondering if it might be possible for you to sit through the summer. Answer by Minister Duclos. As you stated, we are going through an unprecedented situation. As you know, we focused our attention on managing this sanitary crisis, but we also have to work with opposition parties in order to focus on other issues, and that is why we are continuing to discuss with the different party leaders. Follow-up question. So, this is not something that we've thought of. I have a question for Minister Anand regarding ventilators. We seem to want to purchase more of them, but as far as I know, there aren't any provinces that have stated that they have a lack of ventilators. Is there truly demand for that? Answer by Minister Anand. Thank you for your question. It is important to have a short-term and a long-term plan. We don't know what's going to happen with this COVID-19 pandemic. And so, we're going to have to put in place plans for the weeks and months to come, as well as for the year. It's important to have the equipment that Canadians need now and in the future.
Thank you, Minister. Operator, next question, please.
Thank you. The next question is from Laura Osmond from the Canadian Press. Please go ahead. Your line is now open.
Good morning. For Minister Anand, I wanted to ask you about
domestic companies retooling for medical supplies. As the economies are reopening and they want to be getting back to their usual business, how long do you foresee them continuing to make these supplies? And should it be something that we consider in the very long term, having more domestic production of these kinds of things?
It's a very good question, and as I just responded in French, I'll say the similar thing in English, that we don't know how the pandemic is going to affect regions throughout this country in the short and the long term. We also believe that it is important that healthcare frontline professionals have the equipment they need now and in the months and years to come. And so our approach in terms of contracting, both domestically and internationally, is to ensure that we have a steady supply of goods coming into Canada. We've had 34 flights coming in from China recently. But you ask about domestic production, and it is there that it is so incredibly important to focus on, because we want to make sure that Canadians' stores of personal protective equipment and other supplies will be available in the short and the long term. And that's why we have contracts in place to ensure a steady stream of these supplies over the short and the long term. This applies not only to surgical masks, but also to N95 masks. We have a company in Montreal called Medicom that will be producing both types of masks in the coming weeks and months. And in addition, gowns and face shields are also other types of equipment. Hand sanitizer also very important for us to have these supplies on hand ready to serve Canadians as we move through the next phases of this pandemic.
Follow-up, Laura?
Thank you. And for Dr. Tam, I wanted to ask you, what does it tell us, if anything, that 50% of confirmed cases have now recovered?
Yes, so obviously we would want to see the number of active cases, what we call active cases, that those who have not recovered to come down and those who have recovered to go up. And sometimes it can take a bit of time for people to recover as well. And so that's tracked for that purpose. Of course, it's also important for planning purposes, and it indicates whether the health system is still able to cope. So the number of recovered and therefore the number of active cases are important from that respect. But basically, all of the indicators that we're tracking all continue to show that the epidemic, this first wave is slowing down across the country, but at a different pace, of course, depending on where you are.
Thank you, Doctor. Opérateur, prochaine question, s'il vous plaît.
Thank you. Merci. La prochaine question est de Lina Dib de la presse canadienne. La parole est à vous.
Question from the Canadian press.
Go on with what you just said. You say you see that the epidemic is slowing down, but not at the same pace everywhere. Now that almost everywhere is either reopening right now or planning on reopening in a few days, what data are you going to be looking at specifically? Like, what's the first sign that maybe this is not going well and we should be shutting down again?
So at the Special Advisory Committee, which consists of all the chief medical officers of health, we've actually put out the criteria for reopening together with some indicators. So one of the first criteria is, of course, that you have control the actual epidemic transmission. And with that, you look at the number of cases, both linked and unlinked to outbreaks. That's important because you want to see if there are any cases that are suggest that there's community transmission, for which further investigation needs to be done. Obviously, testing and contact tracing is very important to support the tracking of these indicators. And you want to see, of course, case counts, but also hospitalizations, ICU rates, and deaths going down. We have been tracking other indicators. Some of them are more useful than others as the epidemic wave progresses. We talked about this effective reproduction number, and that is how many people a specific case would transmit to. For some jurisdictions, this is no longer a very good indicator because they have such low numbers of cases. But for others, we know overall in Canada, that is tracking just below 1. That is one of the ways that we're also tracking this, but depending on where you're at, that indicator may or may not be useful as well. And so we're tracking the disease indicators in conjunction with, of course, indicators showing that hospitals still have capacity to cope. We're tracking, we're sort of making sure that, provinces primarily making sure that people have plans when they're reopening and that workplaces are supported to do reopening safely. So, and also that we continue to keep importation of cases low. So these indicators are sort of already established as part of the foundations for a national approach, recognizing, though, then there will be regional differences in the timing and how they implement this very cautious reopening.
Okay. Merci. Et Monsieur Duclos?
Thank you. Question for Monsieur Duclos. Why did you increase the eligibility for this $40,000 loan program? Is it because not enough people had access to it? Why did you increase the eligibility? Answer by Minister Duclos. 2 answers. Firstly, as a lot of other programs, this program was put in place very quickly. It was quite effective because over 600,000 small businesses were able to have quick access to this emergency loan. I would like to highlight that small businesses in Quebec are very important to restarting the economy once we are able to do so. Secondly, we noted that with these small businesses, there was a lot of diversity. There were small businesses that were still unable to have access to this $40,000 emergency loan. And thanks to the leadership of the government, but also thanks to the business community throughout the country, we were able to find a way to increase access to small businesses to this emergency account. The goal is to make sure that our small businesses that were important before the crisis, but that will be even more important after the crisis, we want them to be able to help us to restart the economy, and that's why we needed to increase accessibility to this business account. Perhaps Minister Ng might have something to add to what I've already said.
I think that that's absolutely correct. I don't have a lot more to add other than that we have been listening to businesses right from the very beginning, and we've always committed to businesses that we would support them through this very difficult time. And we want to ensure that we are helping our businesses manage and to help them with, the operating costs that they do bear, whether it is utilities or insurance or paying that additional 25% top-up, which I know many businesses do. And over 600,000 businesses have already taken advantage of the loan. And it's those expenses that they are using this operating funds for to help them weather through this period.
Thank you, Minister. We'll now turn to the room, starting with Kevin Gallagher from CTV.
My question is for Dr. Tam. Can you give us an idea about what the public health arguments or concerns are for keeping the Canadian-U.S. border closed to non-essential travel? What are the benchmarks that public health officials will be looking at when and if that sort of regular travel between Canada and the United States starts to commence?
Yes, so again, that is quite a broad discussion, but at the Special Advisory Committee, as I said, we've looked at some of the criteria for lifting some of the restrictive public health measures. One of the sort of consensus approach at the moment is that we have to cautiously lift measures within our borders first, just to see slowly what actually happens, because we want to see that the cases are still suppressed. You're still going to manage, detect, and clamp down on any new sparks that might come up. That's really, really important. And that depends on public health capacity, healthcare system capacity, protecting the vulnerable, and et cetera. But, part of this equation is if you, the international border and the measures that we've put down at the moment, particularly the massive reduction in the number of international travelers, has allowed Canada to manage this first wave of the pandemic. If there is increased volumes, we want to make sure that we have the safety of Canadians at the top of our minds. So we want to make sure we not only keep up, but maybe strengthen some of those measures. The mandatory 14-day quarantining of people who come in remains a cornerstone as we go forwards. And the fact that we have to be able to manage that and ensure that people are following that requirement, and especially if volumes do go up. So some of these are the key considerations. Of course, there are other considerations by other areas of the government that wants to make sure we still get the supplies and everything that we need. There are social and economic impacts that can impact negatively the health of Canadians as well. So we need to also balance that. But fundamentally, it's about ensuring that whatever we do, the system is still able to detect and still able to cope with any introduction.
And just a follow-up, actually on the World Health Organization, Dr. Tam, we've heard from President Donald Trump that he wants to, threatening to pull American funding from the UN agency, maybe even rescinding the membership of the United States. And it comes at a time, whether you agree with the president's opinion or not, of increased criticism against the World Health Organization for its handling of the outbreak. Are you at all concerned or have any ideas about what the credibility or long-term credibility of the World Health Organization, could look like as this pandemic continues to unfold, as we see that there's pressure for an independent investigation to how the WHO handled the beginning of this coronavirus outbreak?
Well, I think, as everyone can fully appreciate, this is a completely unprecedented pandemic, which in the modern era, people have not seen. So I think every organization will have lessons learned. There is absolutely no doubt. And I think from a Canada perspective, and which I think has been made clear in many weeks, that one, now is the time for global collaboration, because we just talked about international borders. And Canada cannot resume some of those activities without other countries also collaborating together to reduce the transmission of the virus. So the WHO actually plays a really critical role in that, because every country now has some sort of measure. And there needs to be I think now more than ever, there needs to be international collaboration, and the WHO is critical in that. But I think Canada is also supporting the call for the independent assessment of the response, not just the WHO, which is the secretariat to the World Health Organization, and the Assembly is the member states as well. So you can't sort of just review in just the WHO response, but how we all intersected with it and how each member state is able to respond to it. And so I think that is the prudent thing to go to do. And I think the resolution at the World Health Assembly just now is looking at this independent assessment at an appropriate time. Because right now, of course, everybody is in the middle of response. And this period where countries, not just Canada, many are beginning to lift those measures, is a really delicate time where I think that massive international collaboration has to occur. So I think Canada supported that resolution, and we will move forwards. I think the other thing is that, I think the WHO is what we member states make it. We can make it stronger and better as part of our international response to future pandemics. But there's no doubt that all of us have something to learn.
Thank you, Doctor. Julie, over to you.
Julie Van Dusen, CBC News. For Minister Anand, in anticipation of a vaccine being developed, I'm wondering, is there anything that you are doing now to get ready, perhaps talking to domestic, international companies about making sure that such like a vaccine can be manufactured here? Are you purchasing supplies related to vaccines in advance, syringes and other things?
It's a really good question. Obviously, as I just said, we are preparing for the short and the long term. And the key point in the long-term preparation is to make sure that Canada is positioned well in terms of procuring and manufacturing vaccines. So by all means, we are planning for that. We are ensuring that Canada would have the additional supplies that you mentioned to ensure that we can move forward with vaccinations when the time is right. No question about it.
Okay, and perhaps a little more detail from Dr. Tam about the border. Obviously, there's health concerns. Are they worried about our infection rate, or are we worried about their infection rate, and what has to change for the border to open?
So, as I've just said, every country is sort of dependent on all other countries, if you actually think about it, and every country has a role in reducing viral transmission within its own borders. So, of course, we will be watching what is happening in the United States in terms of their epidemic and their trajectory. And as I am certain that they will be looking at the Canadian epidemiology as well. So I think that does form part of the consideration in protecting each other's citizens and sort of collaborating on that. But then looking at, well, how can we then safely resume some of the activities? And as I've said, one of the key aspects of that is that anyone who's entering, if they undergo that quarantine period, you can reduce the potential risk of importation. So all of that, I think, comes into play. But the considerations for that international border is much more complex, I think, than just the sort of technical health input. So I'm sure that leaders will be discussing all those other complex aspects to that.
Thank you, Doctor. Mike?
Hello, Dr. Tam. Mike, I have to ask about President Trump has said on the weekend that he's taking hydroxychloroquine, and do you have any thoughts on that?
Well, I think my message is still much the same as what I've said before, which is, we're all wanting to look at viable treatments. Everybody wants an answer and solution. But I think that right now, a lot of the studies are very preliminary on different treatments, and the results have been mixed. However, there's some preliminary evidence from studies outside of Canada suggesting that hydroxychloroquine might have some role or may be effective in reducing some viral load. So our recommendation is that if hydroxychloroquine is being used, it should be part of a clinical trial, for which there are already clinical trials in progress with hydroxychloroquine as arms of those treatment trials. Some of them are essentially being funded by the CIHR, and the Canadian treatment for coronavirus, that the network that's being supported, feeds into the solidarity trial of the WHO as well. And one arm is on hydroxychloroquine. I think it was just very recently, I can't remember which date, also Health Canada approved a trial for the use of hydroxychloroquine in hospitalized children. And that is very important as well, because different age groups can have different responses to hydroxychloroquine. So really the bottom line is that the medication must first of all, be preserved for its current indicated medical treatment, for example, for people with lupus, for malaria, prophylaxis or treatment. And then we need to then have hydroxychloroquine go into clinical trials.
Okay. And so we don't have any evidence as of yet that it's having an effect. And more importantly, what are the dangers of taking a drug that has not been fully tested?
Well, I think any drug has side effects, of course. And so that's part of the study in the clinical trials. And some of it might occur, the trials might start with healthy people first, but you want to see how these drugs also perform in people maybe with at different age groups, but with underlying medical conditions. And there are drug-drug interactions as well. So I think every treatment has its risk and benefits, and that's why you need those trials.
All right, we are going to pull away from the federal briefing. That is Dr. Theresa Tam actually being asked an interesting question there on President Trump's revelation yesterday that he's been taking hydrochloroquine for a couple of weeks now because of some information that perhaps it could help with the coronavirus. And Dr. Tam making it very clear that these have to be this medication has to be part of a clinical trial to test it on how it might reduce viral load when it comes to coronavirus. It is not yet been approved for use in this capacity. It's used for other things like lupus and malaria and other things, but it hasn't been approved for treatment of coronavirus, even though the president did say that he is taking it. All right, I'll bring in my colleagues, the host of Power and Politics, Vashi Kapellas, and the CBC's David Cochran. Just interesting there to get Dr. Tam's medical opinion on hydrochloroquine, because obviously lots of people were very interested in the fact that the president was taking that, even though there is no clear evidence that it is safe to take as a treatment for coronavirus. Vashi, what stood out for you there in all we heard over the past hour?
Yeah, there was a lot. As a treatment, and he's taking it as a preventative measure.
As a preventative measure, you're quite right.
Yeah,
yes.
And he highlighted that, Dr. Tam, highlighted that the tests that are being done, the trials that are being done, and this is what other doctors have said as well, are focused on whether or not it can treat it. And there's only one subsect of one study right now being looked at about it using it as a preventative measure. Like it's tiny, tiny, tiny. No way can you treat that as evidence. And also the side effects in what we have seen so far are pronounced, especially where the heart is concerned. So that's why lots of doctors are saying it's really dangerous if you were to follow this at all. The other thing that stood out to me, actually, I wanted to touch on was the World Health Organization. And Dr. Tam got a bunch of questions about the possibility of a review. Over the past 48 hours, the WHO has confirmed that there will be an independent review into its actions during all of this. And the big question that sort of is the backdrop to all of that is, were they too reliant on information that came out of China at the outset of this and data that came out of China? Think, for example, of the fact that China was saying early on there was no evidence of human-to-human transmission. Dr. Tam said that Canada is supportive of that review being conducted. That is something we've heard from the Prime Minister. I interviewed the Minister of International Development, Karina Gold, last night, who had spoken to the head of the WHO herself to say this is something we're going to support. I asked her about a timeline because everybody keeps saying, well, this review will happen when we're kind of over this part of the pandemic. And I wondered whether should a review wait until there's a vaccine, or does the Canadian government support it happening sooner? And she said that likely it would be sooner when there's a feeling that the world has a handle on this. I don't know if that can happen before a vaccine, but she seemed to think that it might. She also said, though, interestingly, and this flies in the face of some of the actions of the WHO, for example, during SARS, that it isn't the WHO's role to be skeptical of China. So while the government has been clear that a review should be conducted, it has yet to really answer specific questions about the WHO's conduct, or sort of the questions that the government has right now. Should it have been so reliant on China? Does the government itself doubt the information that came out of China? Those questions are not as specifically answered right now, though they have said pretty clearly that they will support that independent review that the WHO has now confirmed. And China, by the way, which initially resisted it, now says it will support that review as well. Will happen sometime in the future.
David, maybe on that same topic, because I also thought it was interesting that, well, I mean, this is sort of what we're hearing from the government and Dr. Tam, that the WHO is only as strong as the member states want it to be and only as strong as the information they contribute to the WHO. But I guess at some point it's about how much skepticism the WHO, as Vashi's saying, needs to apply to the information they are getting from certain member states.
Yeah, I think when this is, as Dr. Tam said, we're still in the response phase in a lot of ways, and in a very delicate part of the response phase as economies start to reopen and gradually loosen some of the health restrictions that have been in place. There's going to need to be an accountability session of some kind on the global response, the national response, the provincial response, and the local response at basically every single level. Was the WHO quick enough to sound the alarm? Was it skeptical enough about what's happening in China? Was Canada quick enough on dealing with travel and border? Were provinces quick enough on dealing with long-term care homes? And were cities smart enough on dealing with local quarantine-related issues? I mean, all of this will be assessed in some capacity. It's kind of a question of when, right? We are still going through this, still living through this, and the ability even to fly and get together and do an investigation doesn't really exist in any meaningful capacity right now, as we're trying to figure out how to ramp up testing and tracing in this country. And on that point, a little bit more on what the Prime Minister said earlier, Rosie.
Yes.
Last week, when he spoke at the First Minister's meeting, it was an offer from the federal government to provide money, personnel, and supplies to help provincial governments and health systems scale up testing and tracing. So it could be anything from offering access to lab capacity, providing them with equipment or money, or helping them with functioning as an HR department to connect provincial health authorities with, say, that thousands of volunteers who have signed up to help with the contact tracing idea through federal government web pages. So this is the idea right now. It's an offer from the federal government. It's not fleshed out much more than that, but it's sort of a no strings offer of support. I guess the only string would be that it has to be used for contact tracing or ramping up testing. So that's where it is, likely to be discussed when the First Ministers undoubtedly have their 10th meeting and phone call of this pandemic sometime towards the end of this week.
Okay. Good. Thank you both very much. I appreciate it. Vashi Kapelis and David Cochrane. You can check Vashi out later tonight on her program, Power and Politics, at 5 Eastern. Thank you. Appreciate it. See you back here tomorrow.
Thanks,
we will leave it with a couple of the recaps of what we heard from the government today. First of all, that Canada-U.S. border will remain closed for another 30 days to non-essential travel. Everyone's saying that is much needed right now as we work to contain it within our country, and the U.S. does the same. But Dr. Theresa Tam saying in her briefing today that we will have to come around to the notion that this will be a summer of, she described it, more restrained movements. Also some changes to the Canada Business Emergency Loan to expand it to include more people. Andrew Nichols will pick up our coverage after this short break. I'm Rosemary Barton. I will see you back here tomorrow. Thank you for watching. Take care.